And all the other governmental agencies around the valley. This morning on the telephone with us, a social distance away, is the Imperial County Chief Executive Officer, Tony Rouhotas. Good morning, Tony.
Good morning, Mr. Buckley. How are you doing?
I am doing well. And, that's the key right now. We're hoping that everybody is doing well. And that's what we want to talk about, is what's happening with the COVID-19 pandemic and how is Imperial County reacting. And we got an update yesterday. Dr. Stephen Monday, the Imperial County Health Officer, reported that the first COVID-19 associated death in Imperial County occurred and updated the number of cases. One of the things that you pointed out and that he has made it a point is that you've got to maintain not just social distancing, but stay home, right?
You're absolutely correct. And first and foremost, since we did have our first loss yesterday, I think we really need to put our thoughts and prayers out to the families and friends of those impacted by this, because that is a sad day anytime, we lose somebody. And, we have seen this nationwide, but now that it's hit Imperial County, it's true to our heart, and we need to take a time and reflect on that and put those people in our thoughts and prayers. As far as social distancing, yes, I think Dr. Monday and I stressed that quite a bit yesterday. And one of the things that we're actually looking at now is telling people to assume that either you have it or people around you have it, that you don't want to expose them and you don't want to be exposed by others. And I think that's a different way of looking at it, but more of a proactive way to keep your kind of like a bubble around you as you're walking through and throughout your day and how you conduct your business. And social distancing, continue to wash your hands, use hand sanitizer, wash your hands appropriately. Make sure you're doing it for 20 seconds at a time and thoroughly with soap, and just keeping a clean environment around you, making sure that you're disinfecting your work areas around you, your home areas, and just doing your part as a responsible adult, responsible child, and making sure you're doing your effort in this part.
Okay. The Imperial County has an emergency operations center at the county fire station in Heber, and that has been in operation for several weeks now. What are they doing? So,
kind of call that your war room if you want. The Emergency Operations Center is housed at the fire station in Heber, out on Dogwood Road, and that is kind of your logistical center point. It focuses on main topics that deal with emergencies. You can call it the FLOP, finance, logistics, operations, and planning. There's different sections in there. And what those sections are doing is, if you have something you need in the field, it's up to the Emergency Operations Center to help facilitate that request of getting those supplies or requests to you. Coordination of we have a humanitarian effort going on right now with the National Guard being in town. Those efforts were coordinated through the Emergency Operations Center, then funneled through the Imperial County Food Bank in the area of Agency on Aging to help facilitate food and meal preparation and meal distribution for people in our community. The finances, cost a lot of this is costing a great deal of money to have all these supplies, so you actually have a finance section that's keeping track of expenditures, policies, and procedures are being followed for our procurement purposes as well, and making sure that's all kept on task. You have a planning section. The planning section is sitting there creating work schedules, not just for the people at the EOC, but people that in the needed areas of our community that constantly have rotating personnel to assist with whatever aspects that need to be happening. And operations is basically what it is anybody that needs operational assistance. Whether it's law enforcement, fire, medical, the operations section is drafting up the plans and setting our priorities for the day. So there's a whole lot going down there. We're trying to do social distancing there as well. During the earthquakes in the past, we might have anywhere between 50 to 70 people there. We're trying to limit that with command staff and the essential people to about 20 to make sure we're actually maintaining our social distancing there as well. So we're actually doing some of that remote, but the heart and soul of what's happening through the day is being done through that facility.
Okay, I have to ask, one of the things that people across the nation keep pointing out is, what about supplies? What about the masks, the ventilators? Are the supplies available in Imperial County?
So what we have right now is we have a priority. We have ventilators and we have N95 masks. They are being kept for first responders and hospitals. They are prioritized to them. We do have additional supplies coming in, and we have received supplies as well. But we're continually, part of what that group is, the Emergency Operations Center is doing, is finding out where the additional supplies are and making every effort possible to go ahead and start earmarking some of those so we know when they can be delivered or when they will be arriving. And that way the personnel down there can also adequately space out the needs and distribution of the products. Okay,
now, of course, Imperial County, but there are 7 incorporated cities. There's 2 health care facilities, 2 hospitals. Everything is being coordinated among the municipalities and the health care facilities.
Very, very good point. Thank you for bringing that up. Yes. So when the EOC, there's briefings that occur daily, multiple times throughout the day, actually. And the one main briefing in the morning, people actually call in, and every city has a designee or a point person that calls in and participating. Some of the cities also, or all the cities actually, have activated their own emergency operations center to handle their initial needs before pushing it up to the county. The hospitals, special districts, and all the cities are all part of this, as well as our state agencies, our local prisons, the state prisons, and as well as our federal partners, BLM, as an example as well. They're all part of the Emergency Operations Center as well.
Okay, and of course, we've had instance with the Emergency Operations Center. I recall an Easter about 10 years ago where it was set up and running smoothly.
Yeah, we try to have it as a well-oiled machine, but that only occurs because the people of Imperial Valley staff those positions. We have a great wealth of knowledge of personnel that know how to step in and run all aspects of the Emergency Operations Center, and it's not just a county effort. It's our nonprofits, it's our city employees, it's our county employees, and it's our state and federal partners. And putting all those people together, it's really neat to see. You're absolutely right. We did see that through the earthquake. We also saw that through the 2010 quake. And I can tell you Imperial County really has a lot of people that will step up when called upon.
Well, that was one of the things that has been driven home over the years in the Valley, that Sacramento, we are as geographically as far away from Sacramento as you can get. And, hey, we can do this. The people in the Valley do come together.
You're absolutely right, geographically, and we have a board member that uses that on a regular basis, that you can't get farther from Sacramento than Imperial County. But it shows you what Imperial County can do standing on its own.
Okay, among the issues that came up yesterday with Dr. Monday and with yourself were stay at home, take precautions, and the idea and the term is flatten the curve. And anybody that's ever taken statistics or is familiar with a bell curve, we are on the upside. Things are going up. Any idea when that curve might start to flatten?
Right now, one thing we are looking at, and something I mentioned yesterday, is we are creating a dashboard. The dashboard was worked on. It's been being worked on, but I saw the first example last night, and it should be online by today to start sharing the curve you're talking about with our local community. It's all of our responsibility. It's my responsibility, your responsibility, and all of our listeners today, that they all have a part in flattening that curve. That's why we keep stressing social distancing, taking the proper precautions, not leaving your house unless you absolutely need to, because we want to see that curve get flattened as soon as possible. Everything we do, our actions that we take, and those that we project, our actions we project to those around us, to our children, How we display ourselves is how we want to send the message. Let's flatten this curve as soon as possible. Let's do the least amount of damage that can be done, but it is all of our responsibilities.
Okay. Anything that we missed?
Well, I want to say that I think Imperial County has the people to flatten that curve, and I think we can make a positive difference. I think we see that some just the people stepping up. We've had some donations of items that are a huge impact to our community. The Masonic Lodge made a sizable donation to our area of agency on aging to help with the elderly and the food programs. I saw something on Facebook where Zendeja's hardware store in Calipet donated some N95 respirators to first responders. That's the kind of community we live in, and I think that's what we all love about Imperial County. I thank those people because, they're going above and beyond at time of need, and it's super appreciated. And I know that doesn't come from me. That comes from the Board of Supervisors. That comes from me, my office. But it also, it's a reflection of what our county is and how we, as Imperial County, can move forward through this and get through this. And I think that kind of sends the internal message. And we need to, even though times are negative, we need to stay positive. How do we stay positive? We're stuck at home. A lot of us, our kids are home. School is out. I think we need to add, look at our family values, stress that to our children that are in the constant house with us. And, they don't get to go out with their friends. They don't get to go out and socialize the way they're used to. But let's take advantage of that. Let's set a message in our house. Let's not let anxiety and panic overtake our lives. There's too much positive that you can reflect on and not reflect on the negative. And I think that's the kind of message we need to send. And we will get through this. And what we put into it is what we will make of it. It'll help us flatten the curve, but it'll help us build an Imperial County, stronger Imperial County for the future.
Well, I think the key right there is we will get through this. And one of the things you should point out, okay, the elderly, this is not just an issue with the elderly.
Absolutely
Kids
not.
Are getting COVID-19 and dying.
You're correct. It's not just the elderly. It's people that could possibly have immune deficiency or underlying medical health issues as well. That's why we have to be so serious. If we can help care for our elderly, our neighbors, our family, we need to do it in a self-respecting manner. I mean, we all want to go visit your grandmother, your mom, your dad, but we also have to reflect, can you do that through other means? Can you do that through FaceTime? Can you do that through Zoom? Any way possible. But at the end of the day, if we love those loved ones, you don't want to impact them in a negative way. Even though you might feel fine, I don't want we shouldn't be looking to take that chance. Social distancing, I can't express it enough.
Chief, we appreciate the visit today, and we're going to be doing this on a regular basis. The Andrea Bowers has been doing a marvelous job with the press releases. My hat's off to Dr. Stephen Monday, the Imperial County Health Officer. Calm, reassuring, but right on point.
Dr. Monday is an awesome person to be able to say that we have on staff. He is truly an expert in his field. He's a great mentor to many, and you're absolutely right. The calm demeanor, he can juggle so many things, but still give you an answer. And you actually see that trickle down through the public health staff. And public health staff has been running their tails off and doing a fantastic job for this county. There's so many little intrinsic things that they do throughout the day that myself or just some of the other general public doesn't realize of all the little details that they're looking into and all the follow-ups that occur. But they're all doing a fantastic job, and they're all being supported behind with 2,300 employees behind them doing whatever they can. I said I was extremely proud. I used an example the other day as I went over to the public administrator's office in the area of agency on aging, and they had that staff there. But around them, there was a public works truck there. We had facilities people, park rangers, and people from behavioral health loading food to be distributed to the needy. And I say that's a reflection of Imperial County that we all want to see and focus on, because that's everybody coming together as a united team. And I've been saying this, and I'll say it again, we are Imperial County strong.
Okay. Chief Executive Officer Tony Rouhotas Jr., we appreciate the visit, and again, we will be doing this throughout this pandemic crisis.
Thank you for your time, sir.
And that interview will be available on our YouTube channel, also on Facebook, and as we said, we'll be doing it on a regular basis, keeping you up to date and informed.
The Imperial Valley's best oldies on the radio.
It's what I listen to.